All right, stop, stop, stop. If you feel like you get queasy because you're seeing a little blood or little bones or teeth being taken out, then go to the next video because this video is going to get pretty graphic. What happened was Dr. David was taking out teeth on one of our assistants. Dr. David is one of our associate dentists here at Thrive Dental. He's a very extremely talented dentist, and him and Steph were gracious enough to allow me to film. So we get pretty graphic, pretty in detailed of how teeth are being taken out. So like I said, if you cannot handle blood, bones being broken and scraped open and all that good stuff, then you probably should not watch this video. But if you want to learn how teeth are being taken out, either it's for orthodontics or they just need to be taken out because they're broken down, you can watch this video so you can see the actual procedure. But we want to do this video so you can see exactly what it's like to get teeth taken out. So we're going to walk you through this. Let's go right now. Let's see the video. Let's see how Steph is getting her teeth taken out. All right, so this is Svanya. We're going to take out her teeth. You can see that there's some really tough to get wisdom teeth, and we're taking out her premolars. One of them had a root canal, and if you're a dentist, you know taking out root canals is even more difficult. But this is a little bit behind the scenes. So this is what a syringe looks like. You know, it's a lot of times you won't see it because the dentist, and Dr. David's great at doing this, he will take it in such a way that you actually never see the syringe if you're a patient. But right here, just before that, he was giving the patient topical anesthetic, so she should not feel this at all. The topical anesthetic is just this numbing gel that gets in there and numbs up that tissue. So now he's giving what we call an IA injection. What this is just really good to numb up the full side of the jaw. He's going in pretty slowly. But then this one is, this one's a palatal injection. So this one, there's pretty much nothing you can do to make it so it doesn't sting for the patient. This is the one that causes the most amount of discomfort, but it's neat. You can see there, right where the needle's going in, you can see the tissue starting to blanch, we call it, or getting white. And that means the anesthetic is working. There's this epinephrine in there that's constricting the blood vessels and making sure that that lidocaine, in this case, stays in there nice and good. So here we go. This is the first tooth. He is using an elevator right off the bat. He's going in there and kind of just trying to move that tooth side to side and get the ligaments out of the way. So the teeth are stuck in there by these ligaments, and if you just kind of move them, it loosens up the tooth. So now he grabs the forceps, he goes right at it, and you can see he's trying to get a good grip. He's trying to make sure that he has a good grip on that tooth, and he's just rocking it side to side. So he's a buccal lingual. He's just going back and forth to try to loosen up that tooth, and probably going to pop out in about 2 seconds, and boom, it's out. So that is how fast those premolars get taken out. Now, this is a little bit more difficult. So if you remember in that x-ray, she had some pretty tough wisdom teeth. So you can see he's going in there with a surgical blade because he needs to go there and uncover the gums on that tooth. So there it's going to get a little bloody, like I mentioned previously, it's going to get a little bloody. So he's going in there and he's creating a flap, we call it. So he's moving the tissue away so he can go in there and he can get at that tooth that's stuck pretty high. So he's going in there with his periosteal, we call it, and he's just trying to he's just basically trying to locate the tooth. Now he has this little elevator, and I think he has now like a little, we call purchase point, where you can get in there and just kind of luxate and get at that tooth and try to kind of elevate it a little bit. So he's getting there. I know this looks like a lot of pressure, but like I said, this is pretty atraumatic, and Steph was doing really good. Actually, I saw her a few days after this, and she was good. She said it took about 1 day-ish to heal, and she was fine. So we're going in there. He's really trying to kind of get that tissue away to really locate that tooth because it was pretty high up. And then we're doing a great job here of doing the suctioning, getting all that blood out of the way so that he can actually see, because that is the hardest thing when it's way back there. Dentists know this. That's hard to get at those teeth because you just physically can't see them. And boom, it popped out. So Dr. David, like I said, is super quick, and most of this is in real time. I tried to edit the least amount that I could so you can see how fast it goes. So with this one, this particular one, he realized, hey, I don't need to kind of cut the PDL ligaments. I can just go right at it, and you'll see how fast it is. And he's putting a good amount of pressure, but he's going slow, and he's making sure to protect the tooth and protect the whole kind of alveolar complex, all those teeth, because the worst thing you can do is just rip on it and then, you know, something crazy happens. But he was protecting the teeth and protecting the jaw. So that came out in what, 15 seconds, 20 seconds? And so now we're going to the opposite side. We're going to the other side. He's going to do the wisdom tooth again. He's doing the same thing. He is getting the tissue away from the tooth. I don't think in this case he ended up using a scalpel to get rid of that tissue, because I think he felt like he could get at it relatively easy. And I want to say this is relatively easy. So a lot of dentists cannot do this. I'd say 80% of the dentists cannot do, probably more than that, cannot do wisdom teeth like this. But Dr. David is a pro, and so that is why I want to film him, because he is just so unbelievably good at this. He's so quick. He's taking his time, and he wanted to make it as atraumatic as possible for Steph. So he's going in there with this little elevator again. He's just trying to locate it. I know sometimes, like I mentioned, that is pretty much the hardest part of this. So you can see his light. That's his light from his little headlamp. It'll go back and forth, because what he's doing is the x-ray is actually pulled up. So he's trying to look, he's saying, okay, cool, I think I know where it might be, so I'm gonna go in there and try to get it. And I think you can just barely start to see it just right now. It's right there. So he can feel it. He's like, I know I got it. But he wants to kind of release some more tissue, because you don't want to just pull on this tooth and just rip all this tissue. You want to release it nicely so that she can heal up really nice and good. So he's getting in there. He's taking over the suction because he wants the suction in a very specific spot. He's getting really close. He's going back in there trying to release that tissue. I think you can just see it just right there. You might be able to see that tooth. And the cool thing is, once he can kind of get at it, once he can get a little instrument on it, then he's going to be able to take it out really easy. I think he feels like he can get it. So he's going in there. Let's see if he can get it. It's really, really, oh, look at that. How cool is that? You could just see it start to come out. There it is. It came out right there. How cool is that? It just, like, as soon as he gets it, it just pops right out. So we're gonna head down to the bottom teeth. The bottom teeth, he actually went too fast on this one. I had to tell him to slow down because I just couldn't film it in time, but I kept this one because this happens sometimes. Sometimes you go and grab the tooth and it falls. And if you can notice there, Steph has this gauze in the back of her throat for this exact reason. Because if you drop the tooth, you want it to hit the gauze and she has to go back up, and he can just grab it and it's all good. And they got the tooth, no big deal. If you don't have gauze back there, what if you pull on that tooth and it falls down? See, they found the tooth, no big deal, but that is why we have gauze there if you're taking out some teeth. So this next one, I told him to slow down. So literally, I think we can count this. He hasn't touched the tooth yet. This is the first moment he touches the tooth. Look, 1, 2, 3, 4, 6, 7, 8. This probably, did that take 10 seconds? I don't even know if that took 10 seconds. That was super duper fast, and that's why I tell patients that is how fast it is. It is, when you're taking out premolars, it's super duper quick. So I just want to show this view so you can see what it looks like from the other side. And sometimes if the wisdom teeth are tough to get at, you have to take this drill and kind of section the teeth in two to bring them out really quick. So this is just another view. I couldn't get a great angle on it, but this is another view. So that is it. That is how he takes out those wisdom teeth and those premolars and makes it look like it is the easiest thing in the world. There you have it, guys. That is how we do extractions here at Thrive Dental and Orthodontics. You can see the premolars and wisdom teeth being taken out. And like I said, Dr. David is extremely talented. I think he took all these teeth out in like 30 minutes. And that's because he was taking his time. He was trying to explain everything, but he took out 4 wisdom teeth, 4 premolars, super duper quick. And the best thing was, Steph was great through the whole thing. She was super numb. So she's gonna heal up perfectly well, and she's gonna be on her way. So hopefully that was educational for you guys. And if you have any questions or comments, please subscribe and please leave them below. And I will see you guys in the next video.